First, let us look at the challenges we face in treating diabetes in 2019. As you look at your practices, I'm sure you're seeing an increasing number of patients with diabetes every single day. As this graph shows, that trend is going to continue over the next several decades. While we recognize that the number of patients with diabetes has been growing and will continue to grow, one of our ongoing challenges is that many patients with diabetes remain undiagnosed. It's important to have an effective tool for screening patients to discover diabetes, and we'll talk about hemoglobin A1c as an option for identifying the unidentified, undiagnosed patients with diabetes in our communities. In this slide, we see the American Diabetes Association 2019 guidelines for diagnostic tests for diabetes. The American Diabetes Association points out that to avoid misdiagnosis or missed diagnoses, the A1C test should be performed using a method that is certified by the NGSP and standardized to the Diabetes Complications and Control Trial assay. If the hemoglobin A1c meets these standards, it may be used for monitoring treatment. It may also be used to aid in diagnosing diabetes. It can also be used to aid in diagnosing prediabetes. It can be used as a screening for children who are overweight or obese and have one or more additional risk factors for the development of diabetes. In patients who have been diagnosed with diabetes, we have these recommendations for testing frequency for hemoglobin A1c. Every 3-month testing is appropriate in individuals who are undergoing changes in therapy or who are poorly controlled. Checking hemoglobin A1c every 6 months in individuals who show good glycemic stability is reasonable. Additionally, testing after 28 days could indicate a trend but not provide an absolute change in hemoglobin A1c based on the British NICE guidelines. Several lines of evidence support the current frequency of testing guidelines for hemoglobin A1c. Specifically, in patients who are not well controlled, who have not achieved an A1c less than 7% or less than 53 millimoles per mole, 4 times per year was the optimal testing frequency. In addition, this every 3-month testing strategy was associated with a 3.8% reduction in hemoglobin A1c compared to a 1.5% decrease with annual testing. Thank you. I'm very appreciative of this opportunity to share our experience and happy to work with the team to continue diabetes education on a worldwide basis.